Okay, so Martin, you got it?
Yeah, sounds good. And then introduce myself, what I do.
I'm writing on behalf of my mother. She told me that a week ago, someone at Oak Street Health called her to make sure she was doing okay. I just wanted to say thank you to Oak Street Health for being a godsend for my mother. She has been so depressed until the lady called to check on her. Thank you.
Hi, I'm Dr. Chow from Oak Street Health.
I am Dr. Levine from Oak Street Health. Caring for adults on Medicare is my passion. By focusing exclusively on older adults, we're able to provide them the best healthcare anywhere, no matter their challenges, because that's what they deserve.
The world has changed seemingly overnight. So we're going above and beyond to make sure all of our patients have what they need to stay safe and healthy in their homes. Now more than ever, keeping up your regularly scheduled doctor visits is important to staying healthy.
That's why we're offering telehealth appointments, which are high-quality phone or video visits that don't require you to leave your home. Patients are telling us how much they love these visits.
I enjoyed the home call because my wife and I both could speak with the doctor from the comfort and, most importantly, safety of our home. That was a relief, considering I'm at high risk for COVID-19. My wife spoke for me as I listened by her side. She's better at talking to physicians, so I'm very pleased with this appointment because normally my wife is not able to go with me.
Plus, our 24/7 patient support line puts you in contact with a care team member day or night, because your health matters to us around the clock.
It's never been more important for you to have a preventive health care plan in place and access to a care team that listens to your needs. So call and schedule a visit with us today. Our commitment to serving our communities is stronger than ever.
And it's the reason why we will be here for you, always.
Hey everybody, this is Pastor G with Alive International. I am so excited to have each and every one of you all joining with us today. We have two great folks on today who are going to provide some very critical information that is going to be valuable to you, to your family, and to your friends. We don't have a whole lot of time, so I want to jump right on in, and I want to bring in the first guest today who's going to do a presentation that I believe is going to be a blessing to everyone. So here's what I want you to do. As I bring Brother Martin Booth in, I want y'all to share this live stream with someone who is 65 and over, someone 65 plus. Now, he'll tell you a little bit more about why in a minute, but I want y'all to start sharing right now. So hit that share button, share it in your messenger, do whatever you got to do. Get on the phone, call some folk, text them, and let them know that there's going to be some empowering information that is going to be provided to you right here, right now. So I want to bring into the conversation one of my good friends, Brother Martin Booth. Brother Martin Booth, how are you doing?
I'm doing good today, Pastor. How about yourself?
I'm doing well. God bless you. We thank you all for joining with us today. And just so the folk can know a little bit about who you are before we get to our second guest, tell us a little bit about who you are, the organization you represent, and a little bit about what we're going to do today. Go ahead.
Awesome. Thank you. Well, my name is Martin Booth. I am the outreach director at a company called Oak Street Health. If you haven't heard of us before, we are a primary care physician's office. And we currently in Indianapolis have 4 locations. I'm at the Speedway office, and I've been at Oak Street for about 3 years. It's an amazing company to work for. We're doing amazing things in the community. I'm pretty sure that if you haven't seen us, you will see us.
Right.
We have billboards, ads, and everything else going on.
Right now, and some of y'all who you may not be familiar with Brother Martin Booth, but you are familiar with the work of Oak Street Health, because I've seen a couple of news reports of some of the work you all been doing, especially in this COVID social. Tell me just a little bit real quick about some of the things that y'all been doing.
So during the COVID-19 pandemic, we actually took food baskets over to residents who needed those, patients and non-patients. So we partnered with the Indiana Black Coalition, Farmers Coalition, and we delivered those bags to their home for them.
Wonderful. And so, let's get into the next person we're going to interview today. She's not quite on with us just yet. She's still coming in to the green room, but we can't introduce her. And so we'll get to that in just a second. So Brother Martin, we have another great guest on. And what are you all going to be talking about today?
We're going to be talking about how do you manage through Medicare during COVID-19.
Okay, so we're going to talk about how you manage Medicare during COVID-19. All right. So this isn't for everybody. Is that the case?
Anybody who is a Medicare recipient, yes.
Okay, Medicare recipient. So does the age range really matter in this situation?
It does not, and we will get into that later. But 65 is typically what everyone thinks when they think Medicare. But you can be younger on Medicare.
Okay, so I don't want. I say 65 plus, and I know you're gonna get into it, but I just want to make sure that everybody understands that there is some information going to be given out today that is specific and particular to a demographic or of individuals. So what that means to me is that if you think this may not, this information may not pertain to you, it may pertain to your mother, it may pertain to your father, an uncle, a cousin, someone like that. So I think, honestly, on all the platforms that we're on right now, and we're live on a lot of platforms, I think that even if you're watching this video right now and you don't see yourself in that particular category, I would suggest, and I want to know if you agree with me, that this information may be good for someone that you know, right? Would you agree?
Mm-hmm.
Okay, so let's do a little quick introduction of the second guest. And again, we're waiting on her to come on, but at least we want you to know who she is so that when she comes on, everyone's familiar. Here it is.
Sandy is our local senior health advocate. Now, if you know what an advocate is, that's just a person that presents your cause and represents you. So we want you to meet Sandy, and she's going to be talking to you in a little more depth than what I have. But we want you to understand we're in your local community. The Senior Health Resource Center, as I said, is in churches. It's in we have it in senior facilities. We have it in community civic centers. We're here to serve you because you served for so many years yourself. Thank you. God bless you. And make sure and listen to Sandy well.
All right.
All right, guys. Well, first I want to tell you all thank you for joining us today. I want to bring on our guest, Sandy Harris, who is our partner insurance agent over at Sandy Harris Consulting. So what she does is she works with us and she partners with us on the insurance side of things. Oak Street Health is a primary care physician. I do want to separate the two of those. More times than often we're referred to as an insurance agent, as an insurance company, but to make things a little bit more clear, we are a primary care physician's office. So you would come to us and see your doctor, you would come to us and get your medications refilled, and today what we're going to talk to you about is how do you manage through your Medicare benefits that you've worked for through COVID-19. There's a couple of things that we want to let you know. There's a bunch of resources that are available to you. Some of these things you don't even know of. Like we said, you are entitled to these benefits, and what we want to do is let you know how you are able to gain those benefits. Next slide for me. So what we have partnered with Sandy Harris, she is running a senior health resource center, and it's helping you again to get more out of your Medicare. There are programs that offer so many more things and benefits that you cannot get unless you ask for it. There are certain plans that are out there that you cannot get certain benefits unless you are under a certain plan. Sandy has all of that information for you. Again, most of these things are not public knowledge. So we want to make sure that we get you to maximize on all of those benefits. You can take it to the next one. So what is your experience in navigating the Medicare world? I'm sure that everyone gets the big book every year, and you probably take that book and you stick it up under a table. It's a lot of information. It can be very overwhelming, especially to someone who is aging into Medicare. There's a lot of information there that you just may not get. For instance, and we'll talk about the two later, there's Medicare and then there's Medicaid. So one is federally funded and one is nationally funded. So with the Medicare and Medicaid, most people don't know that if you have been on Medicaid for 2 years or more and you have worked your quarters, you actually automatically qualify for Medicare. So again, we have Medicaid and we have Medicare. Medicare is the piece we want to talk about that you are entitled to. You work for this. There's a portion that you put away on your paycheck every time you get paid to your Medicare. You receive those benefits once you turn 65. Now, the benefit that you get with Medicare, first at 65, it's Part A. I'm pretty sure everybody is familiar with Part A. If you're not, that's the Part A part of the insurance that allows for you to go to the hospital. So with Part A, again, you're entitled to that. You get those benefits right when you turn 65. If you've been on Medicaid for 2 years or more and you have worked your quarters, you are automatically qualified for Medicare. All you would have to do is just go down to your local Social Security office and apply, and you should be granted that. Next slide, please. So a little bit about Oak Street. We're different as far as your doctor's offices go. We have transportation to and from your appointments. That's every single appointment that you have with us. We will pick you up from your front door. We'll bring it to the center, and then we will also bring it back home as well too. The good benefit about this is if you have children or if you depend on someone to take you to your doctor's office or your doctor's appointments, you don't have to rely on them to do that. They would not have to call off work, take time off. They would be able to let us come and get you and take you back home. The vans are wheelchair accessible. So if you are in a wheelchair, we can bring you there. We also have a community room. Now, during COVID-19, as of now, that is shut down. But we will be reopening that as soon as we can. We also offer same day and next day appointments. A lot of times people try to get into the doctor's office because they may be sick. You may not be able to get into your doctor's office because they may be backlogged. We make time for these visits. We also make time or allot for time on the schedule to make sure that anyone that may have an emergency, we have that time on there for them. You saw in the video as well that since we're in the situation that we're in with COVID-19, we are offering telehealth video and phone visits. If you have a smartphone, you are able to connect with your doctor at Oak Street Health and have a video visit with them in the comfort of your home. If you are not comfortable with going out, you are definitely able to have that visit over the phone as well too, if you don't have a smartphone. So either or. So a little bit of options for everybody. We actually have Sandy Harris, who we will hope to talk to soon, with any questions that you may have about your insurance. We take all the major carriers. There's Aetna, Humana, UHC, and then there's Anthem. So we take the 4 major carriers here in Indianapolis. If you need to navigate through any of those, you can feel free to reach out to us and we will get you in touch with the right person. Hopefully Sandy will be that person or someone like her. We also have 24/7 patient support line. So if there's anything that you may need, you can call us up. It can be 3 a.m. You will be routed to a live person and you'll be able to speak about what's going on. Usually that would be a nurse who would be able to triage you. If that issue is serious enough, then you would be routed to the doctor. But we are accessible 24 hours a day, 7 days a week, 365 days a year. Mail order pharmacy support and access to basic amenities when needed. So if you, for some reason, you can't get over to your pharmacy and you need to get your prescriptions delivered to you, that's no problem. Nowadays, they have everything that you can do through Walgreens, CVS, your local pharmacy. However you get your prescriptions delivered to you, you are able to do that through your mail order. So that's another benefit that we add. We also are able to keep our patients healthy and out of the hospital. So a great number, over 50% of our patients are healthy and stay out of the hospital just because they are a patient at Oak Street Health. So again, we encourage you to come and try us out. Next slide for me. The Senior Health Resource Center is a free educational resource. Now, we ran this program back in, I want to say, August of last year. And we were partnering with some food pantries. And we actually got a number of people who inquired about what we were doing. It's a great resource, again, to seniors. We want to make sure that you guys know how to navigate through Medicare. We're helping them access thousands of available government program dollars. There's things out there for you guys that you are not being told. Medicare is a very, very detailed issue in America. So we want to make sure that you have, again, all that access to those benefits that you are entitled to. If you have worked your 10 quarters, that they require you to work 10 quarters in your life period so that you can qualify for Medicare. If you do not work those quarters, you do not qualify, of course, unless there's certain circumstances where you could be married to a spouse who was. That's different. But for anyone who's worked their quarters, the 10, you are eligible for Medicare. The rules for Medicare change every year. So you want to make sure that you stay abreast of those things because there's a lot of things that you may be covered for one time, but you may not be covered for the next time, or the rates may go up. We want to make sure that you know about those things as well too. So Medicare changes every year, so it would actually be a great idea to read that book and just see what the new updates are. But again, we have the partners to tell you about all of those things. So if there's any time that you have a question, even if you're not a patient, give us a call. We are here to help you, and we will get those answers for you. Next slide. So we said earlier that Oak Street Health is not an insurance company. We're here to help you understand Medicare and your options. From here, we can refer you to an insurance agent who we know and trust. Now, as I'm not an insurance agent, I cannot speak to you on the benefits of Medicare, but I can put you in contact with someone who will be able to tell you detailed information about the plan that you're on, or on a plan that you may be interested in. Right now, I know that the special elections period is extended through June 30th, and then we have open enrollment that starts in October. Open enrollment at the end of the year, you want to make sure that you are active in that so that you can plan for your benefits for the following year. So again, we're not an insurance company, but we do have partners that we work with who are able to answer all of those questions for you. Let's go to the next slide. Who gets Medicare? So Pastor G, you asked this earlier. Are you eligible? People 65 and older, typically we think 65 for senior citizens. Yes, that is the technical age for senior citizens, but that is not the age that you must be in order to receive your Medicare benefits. So there are a number of people who may have a disability and they're under 65. We have those patients. If you are under 65 and you were born with a disability and you aren't able to work, if you were deemed by Medicare, Medicaid, whoever does those things, and they deem you as someone who is not able to work, you are automatically qualified for Medicare. You get those Medicare benefits. We do have 20-year-old patients. So again, 65 is not the typical age or the number for all to be qualified for Medicare. You can be younger. So Medicare coverage related to COVID-19. Medicare actually covers testing for COVID-19, and I can't speak to exactly what the verbiage is on that, but there are benefits that are paid for the testing. The deductible and the coinsurance is also waived. COVID-19 treatment covered under Medicare Part A and B. Now you see, now we have a Part B here. I told you about the Part A. The Part A, again, is the hospital part that you automatically get when you get your Medicare at age 65. The Part B is actually the part that pays for the doctor. So if you go to your doctor and you want to be seen, you have to have that Part B. You also have to have that Part B, of course, if you're going to come to Oak Street Health. We run that through the system for you, the state system. We make sure that you're eligible. We make sure that you have that coverage. And again, we want to make sure that you are covered when you come to us for a visit. You shouldn't have to pay any out-of-pocket expenses unless you have a copay already set up with your insurance plan. If you have that, it's going to be the same thing when you come to us. We have a welcome visit. Is the very first visit that you guys would encounter if you chose to sign up for our services. So again, you must have that Part B in order to see a physician at Oak Street Health. Part A covers the hospital only. So you want to make sure that you get that. Of course, that's what you get automatically when you turn 65. The Part B is the part that you need to have in order to see your physician. If you're on a Medicare Advantage plan, which we'll get into later, you would be able to roll that all into the same thing, and you would just use that one card. So again, Part A, Part B. Next slide. So everything that the Senior Resource Center provides is at no cost to you. They have educational resources to seniors as well as the population at large. They help answer a bunch of questions. I mean, it can be overwhelming again at times for someone who is aging into Medicare. You get a lot of mail, you get a lot of telemarketing calls, you get a lot of people that are trying to sell you a bunch of things as far as your health, and your health is very important. So you want to make sure that you have those questions answered by someone who is licensed to do that. And again, we do partner with those people to make sure that you guys get all the answers that you need that are accurate. There's a lot of fraud going on, and we want to make sure that you guys have the answers that you need so that you can do everything for your health. Next slide for me. All right, so what is the difference between Medicare and Medicaid? Again, Medicare is federally funded. It's a federally funded health program for people over 65 and for people with disabilities. The CARE is, of course, for adults. The Medicaid is for the state-funded health program for any person with low income. So aid, you think of low income. The CARE is for older adults. So they get mixed up and confused at times, but the Medicare and Medicaid, you can have both of these. That is called a dual eligible person. So if you have Medicare and Medicaid, you are dual eligible. Your Medicare is paid through your Medicare premium, is paid for your Part B, is paid through your Medicaid benefits if you have both of those. So they take that out of your compensation that you get from your Medicaid to pay for your Part B premium on your Medicare. So you take that off top, you don't see it, it's already billed, they get their portion of that, and you're all taken care of. This is a great plan to have, this is a great position to be in. Next slide for me. So again, yeah, you can have both, and it's called Medicare, Medicaid, it's called dual eligible. The answer that you need, which plan makes sense for you? Now, every plan is not for everybody. You may have things that are tailored for you that you need. Everybody's situation is not the same, so you want to make sure that all of the options that you have, you discuss those in great detail with a licensed insurance agent. How can you save on your prescription drugs? Do veterans need Medicare? There's a bunch of information on veterans alone that I know of that most people don't know about. A Medicare supplement versus a Medicare Advantage plan.
I'm writing on behalf of my mother. She told me that a week ago, someone at Oak Street Health called her to make sure she was doing okay. I just wanted to say thank you to Oak Street Health for being a godsend for my mother. She has been so depressed until the lady called to check on her. Thank you.
Hi, I'm Dr. Chow from Oak Street Health.
I am Dr. Levine from Oak Street Health. Caring for adults on Medicare is my passion. By focusing exclusively on older adults, we're able to provide them the best healthcare anywhere, no matter their challenges, because that's what they deserve.
The world has changed seemingly overnight. So we're going above and beyond to make sure all of our patients have what they need to stay safe and healthy in their homes. Now more than ever, keeping up your regularly scheduled doctor visits is important to staying healthy.
That's why we're offering telehealth appointments, which are high-quality phone or video visits that don't require you to leave your home. Patients are telling us how much they love these visits.
I enjoyed the home call because my wife and I both could speak with the doctor from the comfort and most importantly, safety of our home. That was a relief considering I'm at high risk for COVID-19. My wife spoke for me as I listened by her side. She's better at talking to physicians, so I'm very pleased with this appointment because normally my wife is not able to go with me.
Plus, our 24/7 patient support line puts you in contact with a care team member day or night, because your health matters to us around the clock.
It's never been more important for you to have a preventive health care plan in place and access to a care team that listens to your needs. So call and schedule a visit with us today. Our commitment to serving our communities is stronger than ever.
And it's the reason why we will be here for you, always.
All right, everyone. This again is Pastor G. We have had on some great information from Brother Martin Booth, who is with Oak Street Health. He's trying to come back in and call us back. We had an internet disconnection, which, you know, with the technology, sometimes this is kind of what we deal with. But what we do want you to know is that the information has been shared through Oak Street Health. We want to make sure that you have access to them, as well as access to Sister Sandra, Sister Sandy, as we call her. Okay, they're calling me back now. Let's see if we can get them in. Let's see if we can get him back in to complete. All right, there he is. We're going to get him back in. That's okay. We're going to get him back in and allow him to continue his presentation. I'm going to show you where you were, and then if you can pick right back up and keep it moving, that'll be awesome. Okay.
Perfect. Thank you. And so these are the questions that you would ask if you were aging into Medicare. These are the common questions that people have all the time. These are the questions, again, that we want to get you answers for. through a licensed insurance agent. Again, we talked about the Medicare Part B, the Medicare Supplement, and the Medicare Advantage plans. Those are different as well, too. So again, many different options. There's a lot of things that people just don't know that we want to make sure that we are there to help you navigate through all of those things, especially since this pandemic is going on. There's a lot of things that affect seniors, older adults. There are things that you guys are more susceptible to, especially since the pandemic is going on. So we want to make sure, again, that we have those answers for you and additional resources. These are the different types of plans. I'll just briefly just go through these. These are the plans that we have. So there's the Medicare. You can have single Medicare. We call that traditional Medicare. There's the Med Sup, which is the Medicare Supplement plan. That's typically the most expensive. It covers the other 20%. Then there's the Medicare Advantage plan. That's everything wrapped up into one. That's the all-in-one card, low to no premiums. We have added benefits, dental, vision, over-the-counter benefits, and more. You see the other plans don't offer those as well. And then you have the Medicare, Medicaid plan that's all grouped together. So you have to qualify for that one. That's the all-in-one card with no premiums and the added benefits. If you see, the last two are the only ones that you are able to have the dental and vision and over-the-counter benefits. So those are the different types of plans that are out there. So you see with Medicare, there's a bunch of things that, or a bunch of options that you have that they're going to pose questions. So again, we're here to help you answer those questions as well. This again breaks down from the Senior Resource Center. What Sandy had done is she shows you how much you would pay for these different plans. This is a lot of information right here. There's a lot of people who are on a fixed budget. You know, they have a certain income guideline. They can't go over a certain amount of money per month. So knowing this and how much you're going to spend is very good information for you to know. Again, so you can connect with us. You can connect with Sandy. Feel free to reach out. If you want to try us out for an appointment, we have the telehealth. We'd be more than happy to see you, talk to you, and help you navigate through these things. Answering any questions. If you have issues with your prescription that you're getting right now, we can help you get benefits for those. There's additional resources for that as well. Again, we have access to thousands of Medicare, dental, and hearing aids. There's over-the-counter dollars, and just help you personally navigate through your health plan. Whatever it is needed for you, that's tailored for you, there's options out there. And we want to make sure that we connect you to those options, especially since COVID-19 is going on. And then we also want to make sure that you're receiving the health that you deserve. So if that's seeing a physician where you have more time allotted, if you need a ride to a center, if you can't leave out of your home for any reason, think of Oak Street Health. We'll be able to help you out in all those areas. Again, I want to let you guys know that the special enrollment period has is going on. It has been extended to June 30th. So you may qualify for a special enrollment period if you missed your chance to enroll in the health or drug plan due to COVID-19. So we're happy to help you out and talk to a licensed insurance agent about that. Again, most people don't know that it has been extended. I personally just found out a couple of weeks ago, but it has been extended through June 30th, 2020. So make sure that you get those benefits to you. Also, we talked about, next slide for me, the open enrollment. So that's at the end of the year. So every end of the year, there's 3 months where you have an opportunity to enroll in the plan that you want for your benefits for the following year. So that's going to be October 15th through December 7th. It's coming fast. It's going to be very busy. Make sure that you have all the information that you need in order to choose your plan for 2021. Very good information. Again, the information changes every year. We want to let you know that we're here for you as well, now more than ever. Since the pandemic is going on, again, we have televisits. If you want to see a doctor through video, through your phone, if you want to talk to them over the phone and have your visit, you can do that in the comfort of your own home. Give us a call. Give me a call. Let us know what we can do for you. If you don't want to get out the house, again, give us a call and we'll let you know what we can do. We'll get you scheduled and get you an appointment. Some safety tips as well. During the pandemic, we want you to make sure that you're staying at home as much as you possibly can. I know the stay-at-home order has been lifted, but we want you to still practice social distancing, wash your hands at all times, have a preventative health care plan. Also, call a doctor if you're feeling sick or need some help. Don't visit the emergency room. We don't want to overload the emergency room. There's a lot of issues going on there already, unless you're experiencing a medical emergency. So those are just 5 tips that we wanted to offer you guys to make sure that you're staying safe during the pandemic. Contact Sandy if you need anything. She will be able to help you out with resources for your plan. So navigating through Medicare and understanding the intricate details of that, you would reach out to her for any insurance issues. If you want to reach out to me for your primary care at Oak Street Health, you're more than happy to do so. Again, I want to thank you guys for attending today. If you know anybody that can benefit from this, as Pastor G said, it could be your aunt, your uncle, your cousin, your friend, your sister, your neighbor. Just give us a call. Let them know. Give them this information, and we appreciate it.
All right, wonderful. Brother Booth, man, I'm going to give you a hand. I'm going to give you a hand on this one. Let's just throw that in there. I'm going to throw that in because we had to shoot from the hip today. We had some, as always with technology, it's possible to have technical glitches, and we had some today. But he says he can't hear me. I know exactly why you can't hear me. Because I am All right, now you can hear me. How's that sound? There it is. I was just letting Brother Martin Booth know we were giving you a hand because of the way you were able to make that happen. Man, we want to thank you for providing this. And Sister Sandy wasn't able to get on, but we want you to know that I have been texting with her, and she is certainly thankful and grateful as well for this opportunity to share the information that we have shared today. And I'm going to show this slide again just to we'll get her in on a later presentation. But again, Brother Booth, thank you so much for providing this critical information. A lot of people right now, I think, are, the pandemic has just done a lot. Social distancing has done a lot to kind of shut down our everyday normal. And I think that in a time like this, when we're dealing with people's health care, and doing things right, and not, like as you say, not over bearing the healthcare system, but doing things preventively, trying to do the things that you need to prevent any issues, I think is what we really need to be talking about right now. Would you agree?
I do agree. And there's a lot of things that people just don't know that they should be doing. So we want to help them get that information. The pandemic is unfortunate. We want to find out what the new norm is going to be like, whatever that is.
Yeah, and we want to help with that. So anything else that we can do, again, we're live on multiple platforms right now. We're going to continue to share this video with as many people as we can. So I'm gonna go ahead and let you off the hook right now. I'm gonna let him off the hook and just let y'all know that y'all can definitely make sure you reach out to us, Pastor G. You're gonna hear some more from Lady G a little later on. We've got a private Facebook getting ready to come up, and I'm gonna share a little video with you real quick that's gonna tell you a little bit more about how you can access that information about the private Facebook group.
Hey everybody, this is Pastor G, and I am so excited about our partners who are sharing such great and awesome information with each and every one of you. And we realize, and we are just thankful that we can provide this information, because right now during COVID-19, this is important information that could benefit you, your family, and your friends. And so right now, I just want to let y'all know and remind those who did not get to see the latest webinar that we are introducing Alive International, which is designed just for our family that are 65 and older. It is called Alive International, and it is a private Facebook group that is designed just for our family that is 65 plus. And so we want you to jump on over, and we want you to join that private Facebook group, because not only are you going to receive great information like what you just saw, but you're also going to receive additional information that will allow you to do things like have fun, connect with others, share information, and really support one another in the midst of what it is that we are going through. If you don't know how to find that page, it is okay. Just find someone, some young person somewhere who can get you close to that page, or you can reach out to us and we'll get you to that private page so that you too can take advantage of of this great information. Again, this is Pastor G. We're opening up a brand spanking new private group called Alive International, and we want to share this with you. So make sure you connect with us. Make sure you go to facebook.com/Alive International, or just type in @Alive International, and you too can join this private Facebook group. And we can do Bible studies, we can do sermons together, we can share great information together, we can have fun together, we can play games together, all that kind of great stuff. And so we're looking forward to seeing you over there. So make sure you join as soon as you can so that you don't miss any of this great information. Again, I'm Pastor G with Alive International. God bless y'all. We'll see you in the private group. All right, peace.
All right, so now y'all know. You know how to get to the private group. Jump on in there, jump over there right now. Share this video with as many people as you can share it with. I'm going to take us out with a little of our jazz, smooth jazz music, or whatever you call it. And so y'all can listen to that until we go off. But until we meet again, Brother Booth's going to be back. Sister Sandra, she's going to be back to share more information. So until we meet again, God bless. And we'll see you a little bit later in Alive's private Facebook group. God bless. Peace.